Hello, good morning. My name is Dr. Tushar Rege. I am a diabetic foot surgeon, meaning thereby a surgeon who deals exclusively with problems related to the feet in diabetic patients. I am associated with SL Raheja Hospital, a prime diabetes care hospital at Mahim in the city of Mumbai, India. My aim today is to tell you something about diabetic foot and to sensitize you in terms of preventing a diabetic foot and preventing amputations. So how does it all occur? Let us first understand what happens in a diabetic. In a diabetic, increased sugars keep circulating in the whole body. And because of this increased sugar circulating in the body, every organ starts getting affected today or tomorrow. Whether it's the heart, whether it's the kidneys, whether it's the eyes, or whether it's the feet. Today, I shall be talking about how it affects the feet. Understand this thing. 3 things in the feet are affected as a result of which a person develops diabetic foot. The first thing is, because of increased sugars, the bacteria or the germs tend to increase significantly in the feet. In other words, if there is a small wound, in presence of increased sugar, the wound is likely to get infected or form pus, in contrast to a person who may have normal sugars. The second thing is diabetic neuropathy. The peripheral nerves in a diabetic tend to get affected. People get varied sensations from burning feet to heaviness of feet to tingling numbness in the feet, but the normal sensations in the feet are lost or diminished. As a result of which one must understand that a person does not realize or understand trivial trauma which occur on the feet, which can ultimately lead to a major diabetic foot infection. And the third thing is that blood supply to the foot is diminished, as a result of which what happens is there is poor oxygenation in the feet. A small infection, a small ulcer, a small wound can flare up, leading to a major problem which may lead to or may need an amputation. So all these 3 things, increased sugar, diabetic neuropathy and diabetic angiopathy or diabetic blood vessel problem, ultimately lead to this condition called a diabetic foot. Why should we be concerned about diabetic foot? Because if a diabetic foot occurs or a diabetic foot infection occurs, if not treated on time, if not treated with proper protocols, can lead to an amputation or it can even be a risk to life. So, understanding that there is something like diabetic foot and then taking care of diabetic foot is important. How do you take care of diabetic foot? I'll just give you a few things. The first thing is see your foot daily. Why? Because a diabetic may not realize that there is some wound or an ulcer on the foot. So what do? See? You have a look at the foot. Any swelling, any wound, any smell, anything abnormal in the foot, seek medical advice immediately. Number 2, open up the interdigital spaces, these spaces or the web spaces, to see if there is any white discoloration. This is fungal infection. A small fungal infection can flare up, leading to diabetic foot. Your nails, cut your nails properly. There are so many people who have a trauma or they injure their foot or their toes while cutting the nails. So many diabetic foot clinics have a pedicure service or a nail cutting service or a foot cleaning service. Why? This is not a spa. But what is important is that it's a medical problem. The nails sometimes are brittle, some nails are so hard, almost impossible to cut. So, when there is a proper service where a trained personnel cuts nails, it is always a safe option. Important thing after this is footwear. What do we mean by good footwear? Buy footwear in the evenings where even a normal person's foot is slightly more swollen than otherwise. So buy footwear in the evening and that footwear has to be one size more than what is normal for you. So wear the footwear, see how it is. The moment you feel it is fine, just ask for one size more. Even at home, you have to protect your feet by wearing proper footwear. There are diabetic footwear with specialized insoles. Use that footwear. Always wear cotton socks. This protection is going to go a long way in preventing a diabetic foot. Lastly, no massage, no hot fomentations, because we have seen this simple thing which a person tends to do can again have a massive problem. What all I have tried to tell you in brief is that don't ignore a diabetic foot problem, and because you should not ignore the problem, you should be aware that diabetic foot problems can occur, because if they are ignored, if there is delay in treatment, the results can be catastrophic. If you have understood what we have tried to tell you about diabetic foot, tell it to at least one person, because the mission of all of us in this year 2020 and the coming 2021 should be that we have to prevent or attempt to prevent amputations, because once an amputation occurs, the whole life of this person changes. We all have passed through difficult times, the COVID times, something totally unexpected. We have never seen this in our lives before. And the first few months were a trying period for doctors as well as patients. Our diabetic foot patients were holed up at home just because they could not get transport, hospitals were not available, doctors were not available, and had massive catastrophic diabetic foot problems. So, it is important to understand that an immediate or an early treatment or an early referral to a foot specialist is important. We at Tushar Rege Hospital now have a completely segregated COVID and non-COVID units, where a patient who has a diabetic foot problem will be catered to by a completely dedicated staff who does not intermingle with the COVID staff or with the COVID patient's care. Therefore, this can go a long way in treating patients. At the end of it, I would again like to reiterate that don't ignore even the slightest or the smallest of diabetic foot problem. Seek medical and surgical advice at the earliest, and be sensitized to the fact that even a non-painful, so-called normal foot can be an abnormal foot, and try and counsel at least one person about all this, so that along with you, even he or she does not have to go ahead with an amputation. Thank you so much and have a nice day.